Ramadan is normally a very sociable time as abstention from food and water during daylight hours gives way to sumptuous meals and gatherings at dusk.
But this year, the coronavirus pandemic has cast a long shadow over the rituals, which have been modified to fit public health directives on physical social distancing.
And joining us now to discuss is cultural anthropologist at Rutgers University, Dr. Donna Auston. Doctor, welcome to the program. Thank you for joining us. So what is going to be different and what looks different about Ramadan this year?
Well, I mean, first of all, many of us are just dealing with the generalized anxiety of dealing with this illness that is in our midst and is disproportionately impacting Black communities, in particular in the United States. So, I mean, where normally people would be in a celebratory mood, right? It's a little bit harder to do that, or we're having to work harder to even get to that point, right? When we're just dealing with so much death and suffering around us, right? In addition to that, of course, there is a lot of communal gathering, shared meals, prayer and congregation at mosques, and in people's homes. And with the social distancing guidelines in place in most states, those things are not really possible at this time.
Dr. Auston, we know that fasting requires you to go all day without eating, having any meals until sundown. Is there any concern of health risks in terms of your immune system being weakened because you're not sustaining nutrition during the day?
Well, in general, people who have compromised immune systems or other underlying physical conditions that would pose a health risk to them are exempted from fasting under Islamic religious law, and regardless of the pandemic, right? This is sort of the normal rule. Otherwise, I mean, I'm not a medical doctor, right? But I do know that there are some medical professionals who believe that intermittent fasting actually does have immune boosting properties. But we don't ask people to jeopardize their health in the name of religious rituals. So this is something that we ask people to proceed with in conversation with their health care providers and knowing their own health and medical history before deciding to undertake the fast.
And also, Doctor, thinking of Ramadan outside of the United States, a number of people, spend their whole lives like planning to go to Mecca or to make that pilgrimage, and they're not able to do that. How much of not a disappointment, but how do you fill that void?
Yeah, it's really tough. I mean, these are, Ramadan comes around once a year, and that's, though a lot of people do make the minor pilgrimage to the holy cities during this month, the actual ritual of Hajj happens about 2 months from now, right? And it's unclear as to whether or not, and at this point, it's probably unlikely that it will happen in the form that it normally would take. These are rituals that people save their whole lives to, or sort of arrange their affairs in such a way that it's very difficult to have these things happen. It's like a once in a lifetime opportunity for most people, if they have a chance to do it at all. So it is very disappointing, I think, in a lot of ways. But I'm excited. I'm happy to know that the custodians of the holy sites are, taking this threat seriously, and as is required by our religious law, right? We prioritize health and safety of human life over ritual, right? And these things can happen, again, when it is safe to do so. But right now, it's not really possible, and it is a disappointment. But it's the right call.
So, Dr. Auston, can you tell us, for those who aren't as familiar with Islam and being around Muslims, there are a number of African Americans as well as Africans and Blacks around the world who are celebrating Ramadan, a large population. If you could talk about that and maybe explain to people a little bit about what exactly is Ramadan.
Well, Ramadan is the 9th month on the Islamic lunar calendar. And it is the month where it is believed that the first revelations of the Quran, which is the holy book of the Muslims, was revealed. the first revelations came to the Prophet Muhammad, we believe, during this time. And so for that reason, right, it is considered a very sacred month where people, in addition to observing sort of the physical practices of the fast that you discussed before, right? Abstaining from eating and drinking, and also for people in relationships for abstaining from sexual relations during the daylight hours. There's also a big emphasis on sort of controlling one's tongue, refraining from getting angry or speaking ill or speaking unkindly towards people. Increased devotional practices, both by alone and in congregation with one's family and one's community. It really is seen as a time where Muslims, sort of a once a year renewal period where we engage in a set of practices, increased giving of charity, all of these things where we sort of, engage in this intense motion towards the divine, right, in this month. And so it is really a special and sacred time for Muslims around the world. And as you mentioned, that includes in the United States, probably between 25 to 35% of the Muslims in the United States are people of African descent, African Americans, but also people from the Caribbean and with roots in the African continent. There's a huge population of Muslims across the continent of Africa, but also in the Caribbean, right, amongst the Black populations there. So it is a religion that is practiced by, millions of Black people worldwide. And this time is very special for us, is very sacred for us. And these conditions that we are observing the fast under are certainly unprecedented in a lot of ways. But we are hopeful that this time will be blessed nonetheless, right, for not just for our communities, but for the entire globe that's struggling with this disease at the moment.
All right, Dr. Donna Auston, thank you so much for those insights. We've learned a lot this evening. Thank you. Please be safe and be well.
Ramadan Mubarak.
Thank you.